Patients arrive, then they're going to come over to the hair check zone, and so they would be placed in one of the exam rooms like this one. So this is a hair check zone. The patient would have a seat. We're going to do some measurements of their hair mass, which is done with a hair check tool. That's a device that measures a combination of hair caliber and quantity in different areas of the scalp. So we can go back to the same areas again and again over time and measure and track their progress with any treatment or procedure that they've had. I mean, this is the probably the best tool in the toolbox in terms of tracking the hair loss process.
Wow.
Because this enables us to measure over time how you're responding to treatment. And it can also help us with diagnosis in the beginning because we can measure areas that are more permanent and compare it to other areas that are prone to hair loss. So there's two steps to the hair check process. The first step is a stereotactic device like this, which helps us get back to the same area of the scalp again and again. So these tab numbers here are centimeters from the bridge of the nose.
Okay.
So without making a tattoo, without having to trim any hair, we can perform this evaluation in about 5 minutes time.
Yeah.
So if you put this on, you put these glasses on, then we can go back to different areas and track over time.
Yeah, that's the control, isn't it? Yeah.
So each specific zone can be measured. So we'll typically do 3 to 4 measurements on each patient. The hair in a 2 by 2 centimeter area is marked off and bundled together and separated from the rest of the hair on the scalp.
Okay.
And then that bundle is measured with this caliper. So it's an electronic caliper. So it squeezes the bundle and measures its cross-sectional area. And once that's completed, it gives us a readout, it gives us a number. And that number, or hair mass index, is a combination of the number of strands that are in the bundle and the thickness of those strands.
Wow.
So it's very, very sensitive. We can tell, you know, if you lose a couple strands of hair, the number will change.
Yeah.
If your existing hair stays exactly the same in terms of density, but you get a little bit thicker hair growth than before, the number will change.
Yeah.
So it's a very sensitive measurement of how your scalp is responding.
And obviously throwing into the mix, obviously people are shedding hair all the time, you know, as a natural process of, 100 hairs, 150 hairs a day. So how do we factor that into the equation to know where the control lies?
Here's the best way to go. Here's the best way. This, if someone comes in with a hair shedding problem and they're concerned, they're like, oh my God, my shedding is out of control.
Yeah.
Now I've stopped washing my hair, and every time I touch my hair, I see more shedding. What the question is, well, shedding is going to happen normally, about 100 to 200 hairs per day. But the question really becomes, well, how much hair is regrowing to replace those hairs, right? This will tell us.
Okay.
Because in 90 days, I can tell you whether those hairs were replaced or they were not.
Wow.
So I'll be able to tell you whether you're trending lower or trending higher.
Yeah.
Because sometimes, for example, a strong treatment like a very powerful laser device or a PRP treatment can trigger a little bit of a shed in the first month or two.
Indeed, yeah.
But 90 days out, what's going to happen? We're going to measure more hair. This is an iPhone appendage. This is a hair cam. This is a photo I took yesterday of the scalp, and we can see it up here on the screen. We're going to look in the different areas and see what's going on. Normal scalp should be, all of the hair caliber should roughly be about the same. 95 to 98% of the hairs should be thick and strong. If we're seeing a lot of miniaturized hair, a lot of weaker hairs, then we know something's going on. It's not a healthy area of scalp. Or it's starting to regrow. So depending on the patient's story, depending on their situation, depending on their history, this will help us figure out, when we correlate the visual view of it under the microscope with the measurements, we'll know what's happening over time.
Yeah, great.
And that gives us a clinical picture of what's going on.
And in turn, you can instill a great deal of confidence in the patient.
Well, absolutely, because isn't it great to know that your treatments are working?
Exactly.
Before you have had a chance to actually see the result in the mirror?
Indeed.
I mean, that's really, really important.
Yeah, definitely. Good point.